Susan Sontag, you may know, died in 2004 of a leukemia-like disease called the myelodysplastic syndrome. It was her third bout with malignancy. She'd previously survived treatment for metastatic breast cancer and before that for uterine sarcoma. But despite being told otherwise, she apparently presumed she was also going to survive this malignancy. And in pursuit of a cure, she demanded experimental therapy with a bone marrow transplant that her insurance company wouldn't pay for, so she traveled to get it and paid $300,000 in cash to have it done. And then when she was informed that her cancer hadn't been cured by the procedure, she apparently screamed at the medical staff, her family, and presumably the universe itself, "This can't be. This means I'm going to die." She went on to seek out further chemotherapy at Memorial Sloan Kettering, which also failed. She spent her last weeks in a state that her psychiatrist called, quote, protective isolation, almost unable to express herself. She kept taking the chemo pills until she could no longer swallow them and died in a hospital bed, wasted, delirious, septic. Her son described the last chapter of her life as a courageous dying of her own death. The death of a woman who had always defied the odds and would never take no for an answer. The only conceivable argument he could muster against this kind of death was one of justice, and his solution was that we should make it possible for everybody to have the money spent to die this kind of death if that's what they want. Now, I never met Susan Sontag. I've read some of her work. I can't presume to know her in any deep or intimate way, or know why she chose to die this way. But I don't want to run away from the question of whether it's possible to judge that this death was a good or a bad death, independent of questions about justice and resource allocation. And I want to use her very public death to illustrate a kind of dying that's become very common in the Western world, a death that I would characterize as desperate, isolated, agonizing, yet freely chosen. Susan Sontag is not alone. Patients dying of cancer who enroll in early phase clinical trials, the purpose of which is to test promising drugs for the first time in humans to see if they're toxic, have been asked about what outcome they expect from taking these experimental drugs. And even though they're supposed to only benefit up to 5%, the typical subject reports 80% confidence that the drug is going to control their cancer. The reasons they give for these high expectations of benefit reflect an optimistic attitude, mostly faith in medical science, although sometimes a faith that God will rescue them from death. They conceive of the struggle with cancer as a fight they're not prepared to consider losing. And they believe that an optimistic attitude can improve their own odds of benefit. And many believe that this has been scientifically proven. Very few mention anything about accepting God's will or express a hope that they will be received into God's love no matter what might befall them. In the discourse that dominates the care of patients dying of cancer today, the word hope is almost always used to convey a sense of optimism about medical benefit. By contrast, Václav Havel has written that hope is something different from optimism. Hope, he argues, is not the belief that things will turn out well, but the conviction that things will make sense, no matter how they turn out. Havel's hope is not that of the contemporary cancer care world. There is empirical proof that at least some of this optimism that patients report is psychologically unrealistic. The majority of patients think that their chances of benefiting are better than those of the average patient, which of course, mathematically speaking, isn't even true in Lake Wobegon, right? Patients report that they are encouraged to think optimistically by their families, by their religious congregations, and the medical staff. And we even use these words continuously. Hospitals have named things like the City of Hope. Newspapers report regularly on cancer screening experiments offering baby boomers the hope that they can avoid cancer. It shouldn't be surprising, therefore, that patients have this kind of optimism. It must also be noted that this description of a sort of medical and social conspiracy to maintain the optimism of patients is only part of the story of hope and care at the end of life. From another perspective, medicine is also busy robbing dying patients of hope on a routine basis. Because when physicians come to the conclusion that the prognosis is grim and that there are no grounds for optimism, they routinely declare those patients to be hopeless cases. And euthanasia and assisted suicide are now prescribed for the hopelessly ill. The medical discourse surrounding hope is thus oddly a two-edged sword, inviting both the overuse of medical technology and euthanasia. Such is the strange world of contemporary medical care. And it's not just oncologists and intensivists and cardiologists who offer this hope. Even palliative care doctors in their own way buy into and accept the discourse of hope as optimism. Palliative care specialists portray themselves as the enlightened ones who want to support patients through the dying process and repudiate both unrealistic optimism about patients' prospects as well as the notion that the patient should be robbed of hope. And their solution is what they call reframing the patient's hopes. So that when cure becomes impossible, they teach that patients might learn to hope for remission. And when remission becomes impossible, they might hope to earn quality of life. And when quality of life and duration of life both begin to shrink, they might hope for short-term survival and the ability to attend particularly important family events. And when even short-term survival becomes impossible, they can hope to live with their symptoms well controlled, and so on. I wonder, however, how these experts ever came to believe that dying makes people stupid. While well-intended, these experts in palliative care can't seem to realize that a dying person is perfectly capable of seeing that the successive circles that enclose the hopes that they are being given in this reframing by the caring doctors just keep getting narrower and narrower. Patients are perfectly capable of seeing that the final result of this successive reframing is nothingness. Now, is that a hope that sustains a dying person? One might ask what the alternative could be. The alternative that medicine is now prepared is to offer a program of longevity research and life-extending programs. You heard a little bit about that, I guess, earlier. Certainly no one questions that it's good and noble for medicine to treat diseases and prevent premature death, but medical science is progressively turning its attention now to studying and promoting longevity, finding out how to make people live longer by methods such as calorie restrictions, antioxidants, or regenerative medicine using stem cells. And people are talking about 200-year lifespans. Well, life is good, but is more of it always necessarily better? Is longevity our hope? It would seem that indefinite ongoingness falls far short of eternity. Yet indefinite ongoingness is the last hope that medical science could ever possibly conceive or give. Is indefinite ongoingness the object of hope for which we strive as human beings? That seems to be what Sontag sought. Her son says, "I believe that even if she had been offered the possibility of an immortality that consisted of nothing but consciousness, that is, of continuing indefinitely to know what was going on, and even if it was the science fiction immortality of a disembodied head, she would have accepted it with relief and gratitude, perhaps even with appetite." Now, a sensible philosophy of medicine, not science fiction, seems even more necessary to answer questions like that. Medical thinking is still overwhelmingly dominated by mechanistic theories. An 18th century French physiologist wrote, "Life is the ensemble of functions that resist death." This is still the notion that dominates all of society's thinking, socially as well as medically. Life is a temporary blip in the rolling tide of entropy. Death is normative, and life is the willful resistance to the norm of death. So the question arises whether death is a metaphysical truth or merely an empirical observation. And if finitude is merely an empirical observation, then it may well turn out to be something that medical science might one day overcome. Willful resistance might win the fight against death through human ingenuity. That was certainly Sontag's hope. But if you do the math, you realize that no amount of indefinite ongoingness actually adds up to infinity. So if hope is a type of desire, and the deepest desires of human beings are for infinite life and infinite love, then those desires cannot be humanly fulfilled. And if those hopes are to be realized in any way, experienced in any way, in the finitude that appears to be our lot, then all human hopes must eventuate in infinity that is resident in the finite, in a transcendence that is actually immanent. And such a transcendent hope is central to the Christian message, a message that nothing empirical can give to the human heart. That while the finite can never add up to the infinite, the finite has been informed by the infinite, and that this is our only true source of hope. Now, a while ago, shortly after I set out to write this, I was experiencing a prolonged bout of writer's block. I had finished other portions of this, and this is going to hopefully be part of the book. And I'd finished several other chapters, but I was in this period of block, and I was going on my annual retreat, and I chose a place to go that was for quiet and prayer, and I wanted a place that was surrounded by natural beauty, had a place to hike, and had a hermitage. And I wound up going to a place called Still Waters. It seemed to me from the website to be probably a Christian enterprise, almost certainly not Catholic. I wasn't sure if it was a little too new age or not for me, but since I was looking for silence and didn't really plan to have a lot of conversation with anybody else, I figured it didn't matter. The setting was right, and there was a Catholic church nearby that I could go for Mass, so I decided I'd give it a try. And upon arriving, I learned that the hermitage where I was going to be staying was named Tikva. Initially, I actually thought this was a Native American word, but that's only because I don't know any Hebrew. Tikva is the Hebrew word for hope. And the door to my hermitage cabin had a wooden sign with that Hebrew word on it, carved in the wood. And although I had not set out on retreat with the intention of reflecting on hope and overcoming my writer's block, the nagging thought that I needed to do more writing about hope had been rumbling around in the recesses of my brain for several months. I tried to force myself to write on the topic. It hadn't worked. And so I took this sign on the door as somehow providential. Not yet inspiring, but providential. And as I unpacked my little knapsack once inside the cabin, actually insight came. It was a very simple insight, but I think important. It struck me suddenly, in this cabin, that nothing happens when you come to a place called hope. The world is not altered when one comes to a place called hope. And that insight became an inspiration, in its own way, a small source of hope. I think it's true that nothing changes when we come to a place called hope. The all too human expectation that things will change or somehow must change might be the greatest of all barriers there actually is to hope. Hope is not an act of manipulating the world by the power of one's mind. Nor is hope an act of bringing the world into conformity with one's will by using God as one's agent. The latter way of thinking about hope is all too common, I think, among people of faith. The attitude that the world can or must change because of our expectations or desires or prayers can seem like hope, but it's not genuine. What seems to us most of the time to be hope may not be hope at all. The hope which St. Paul sees, the hope he wants to see in the example of Abraham, is hope against hope. This difficult and confusing phrase, now an idiom of our common parlance, comes from Paul's letter to the Romans. I think that what Paul means is that if we're open to receive it as a gift, God can grant us true hope. A hope that stands against the false hope to which we are continually tempted. Paul urges that we should reject the notion that the world needs to change because of the hope that is in us, urging us instead to be changed ourselves because of the hope that is already in the world. Christian faith holds that the hope that can transform us is a hope that is already in the world, a hope founded on the incarnation. Faith that God is in the world, that the Word dwells among us, is thus truly the substance of what a Christian hopes for. Now, some sensitive and enlightened palliative care physicians have tried to move the field a little bit more than what I was talking about before, and they've quoted Robert Frost, who wrote that the best way out is always through. And in this vein, it might be said that the hope of the Hebrews, their tikvah, came only by way of a passing through the Red Sea, through the Sinai Desert, into the Promised Land. And in the modern era, the Israeli national anthem, Ha Tikvah, was sung in the dark thoroughfare of the Shoah. Israel's constant temptation, indeed humankind's constant temptation, has always been escapism. In the book of Exodus, the Israelites are constantly complaining against Moses. Take us back to Egypt. Did we come all this way to die of thirst, only to starve? And even when their needs are met, they complain, we're tired of this wretched food. They look for a way out. And finally, when Moses doesn't deliver, they construct the golden calf, thinking that's their way of deliverance. True hope, the hope of Abraham and Moses, is a hope against such hope. We Americans in particular are deeply afflicted with the temptation to think about hope as a way out. We're immersed in a sense of hope as optimism, or hope as escapism. Hope as a power to change the world into conformity with our own wills. Such attitudes are not exclusive to the sick and the dying. Part of America's manifest destiny, Nike shoe advertisements that say the impossible is nothing. And that's why in the end the death of Susan Sontag ends up looking exactly like the death of a poor woman whose family is praying for a miracle and demands continuation of so-called aggressive treatment well past the point that clinicians think it's reasonable. It ends up in the same kind of treatment. Both kinds of death spring from a conception of hope that's trying to manipulate the world into conformity with one's desires. If hope requires that the world conform to one's will, and one concludes that the world will not change, then hope evaporates, and one is left with utter despair. And some are thus led to conclude that if hope is a way out, then the only hope is suicide. Thus, both the demand for futile treatment and the demand for euthanasia may have a common source, a sense of hope that's understood as a quest for a way out by the force of one's own will. The hope of one who follows Jesus stands against such hope. The hope that is nurtured by such faith doesn't define itself as a quest for a way out. Even talking about a way through, however, may be inadequate to describe a Christian notion of hope. On further reflection, Frost's way through may be American neo-Stoicism. While an improvement on hope as a way out, the notion of hope as a way through, I think, also fails to capture the depth of the Christian notion of hope. It is common and noble to pray for the strength to endure one's inevitable trials, deeply in sickness. I'm not denying that. Pain, chronic illness, depression, broken families, rejection, ultimately one's impending death. It's common and good to pray for one's strength in such circumstances and to pray for others. But even asking for a way through can become a kind of escapism or merely survivalism. Christian hope is something deeper than the strength to survive life's travails. Now, perhaps the medieval practice of walking a labyrinth is more evocative of the Christian notion of hope. The practice of walking a labyrinth is more than a technique for meditation. Labyrinths are also teachers. In walking a labyrinth, one certainly does not seek a way out, but neither does one seek a way through. The point of walking a labyrinth is the quest for a way in. To walk a labyrinth properly is an exercise in hope. One's attention becomes focused on putting one foot in front of the next and going constantly forward, not knowing when or how one will arrive at the center, but confident that there is a center. In walking a labyrinth, one accepts the inevitability of twists and turns and the inevitability of the unexpected. One who walks a labyrinth properly does not cross the lines. One does not try to cut to the center or escape the unfolding of the labyrinth's circumference. One moves graciously along the lines that are given, further and further along its path, heading for the depth that lies at the center. One must be patient in walking a labyrinth. One must accept its lines and move within them. I would like to suggest that the Christian notion of hope is like walking a labyrinth. Hope means following the path that leads to the center of things, to the Word that is in the world, the Word through which the world came to be. The path to the center requires that one continually move forward, not turning back, accepting whatever joy or beauty or suffering or ugliness accompanies the journey. One accepts the twists and turns and moves forward towards the mystery that is the center. This is how genuine Christian hope can help us to move from mere survivalism to salvation. Hope, as a virtue, has traditionally been considered a supernatural virtue. The hope that stands against hope is an infused virtue, an inbreaking of the sacred upon the confines of the profane. If there is no transcendent basis for hope, then the human encounter with death must be either desperate or indifferent. Desperate if one allows one's deepest human desires a space for expression and finds that they cannot be fulfilled in this world, and indifferent if one is successful in suppressing those desires. If there is a transcendent basis for hope, however, such hope might also seem to be a fairy tale. If that hope is conceived of as a way through, as a rite of passage to be endured on the way to an otherworldly conception of heaven, then that criticism might be valid. But hope as a way through, as I've noted, is also escapist, looking for an eventual way out as a form of delayed gratification. The hope that stands against hope is a way in. Finding hope, finding grace at the center of what is real and present. Ultimate hope must be an abiding hope. Hope as a place where one can live freely and fully. Hope against hope abides. It is a place where we can live now. And such a hope is sacred, not profane, and yet can be experienced in the here and now. Such a hope is eschatological hope, positing a future that is already in a certain sense present. It concerns the here and now as it is apprehended through the transcendent, both here and everywhere, now and always. It is the transcendent call of love, beckoning us to move beyond ourselves, that is the true substance of what we can hope for. If that love is actual and imminent in human reality, in sickness and in health, in our living and in our dying, deep within the world we inhabit, then ultimate hope is possible and real. I think that's what the gospel teaches us. Perhaps there is no fully human life that is not at the same time a process of dying to the self, which is a way of defining love. For a human being to live his or her life as nothing more than a state of temporary resistance to death is a formula for despair. But a life that is lived ablaze with love, surrendering to the death that's inseparable from the love that transcends it, is a life that can be lived in hope. Now, can we teach such hope to dying patients or to the doctors or nurses who attend them? As patients and healthcare professionals, both in the setting of chronic disease and at the end of life, we need to learn to think more about the way in, and less about the way out, or even the way through. We need to learn what it means to hope against hope. We need to recognize that mechanistic accounts do not suffice to define human life. We need to offer the dying a hope that is expansive, not one that contracts perpetually every time we reframe it. We need to find the hope that is not an optimistic expectation of a miraculous cure, that's not an attempt to bend the world to our wills, either using God or science as our instruments. We need to come to that place of hope where nothing necessarily changes. We need to look for the still point at the center of human life, which is the dwelling place of the God who is love, where we can abide in hope, whether as patients or practitioners. This is the place of hope that affirms life in the face of death, not denying death's reality and inevitability, not vainly attempting to escape, but finding the sense that love makes of the lives we have been given. We need a hope that is present in the reality of suffering and death and in the loving ground of assistance that constitutes the basis of the healing arts. I think if we understood hope this way, it would radically change our discourse and our practices surrounding the care of the dying. Such hope is perhaps the medicine that all of us most need.
Well, thank you, Dan, for a very thoughtful and I would add inspiring paper. When Dan sent the paper to me last week, he said, "I'm afraid that this is a bit more spiritual than theological, as if an apology." And I took a quick read of the paper and I shot back and said, "Dan, I think it's both. They go hand in hand," and I think he accomplished that. Hope is a theological concept, and the journey to it is a spiritual journey. Now that may be open for debate, and we in some ways have been talking about that in different ways throughout the day. As we think about hope theologically in the context of death, I think it might also help to reflect just a bit on a theology of death. As I read Scripture, I see a creative tension with regards to death. Death in the Bible is both friend and foe. On the foe side, we have texts like 1 Corinthians 15, it is the last great enemy to be destroyed. In the Psalms, it is associated with despair and anguish, and in Hebrews 2:15, with fear. But death is also portrayed as friend. Psalm 116:15, precious in the sight of the Lord is the death of his saint. The Old Testament at times speaks of being gathered to one's people as almost as if a natural process. In Philippians 1:21, someone alluded to it earlier today, for me to live as Christ and to die is gain. It seems to me that this creative tension precludes a radical response to death, easy death, where we view it only as friend, as we would have in euthanasia, or a radical rejection of death as enemy, an undue prolongation, as you had in the story of Susan Sontag. This, of course, is a theological understanding of death, not a mechanistic one, in the same way that Dan has pointed out that hope is a theological construct, not a mechanistic one. Thus, hope in our approach to death is not a way out or a way through, but a way in. But of course, all of this creates a dilemma. If the Christian conception of hope and death is theological and transcendent, how does all of this relate to the common good? How do we seek culturally, or how do we seek in the practice of medicine to, in some manner, ameliorate the mechanistic version impacts that lead to both deficiency and excess in the face of death? Hope is not a cardinal virtue. like prudence, temperance, fortitude, and justice. Virtues that in some manner can be perceived by reason or intuition or by human experience. Hope traditionally has been understood as a theological virtue: faith, hope, and love. The path to the theological virtues is grace, and they are understood through special revelation in Christ and Scripture. So if hope as a theological virtue is transcendent and focused on the way in, that is a Christian spiritual exercise, can it possibly play any role in a pluralistic world where particularistic understandings are neither operative nor welcome at the table of discourse? In other words, as Christians, can we ever hope that our versions of hope and our understanding of death might in some manner function even as salt and light in this complex, pluralistic, and fallen world? Well, I'm not optimistic that we could ever expect that the particular transcendent notions of hope could play a significant role for the common good, at least not beyond our personal interactions and our personal impacts. But I do think there's a Christian conception that might play a common grace role in at least restraining some of the ill effects of a mechanistic paradigm. When we speak of common grace, really comes out of the Reformed tradition. It's the notion of the grace that God imparts to all human beings, whether or not they respond to the salvific grace in Christ. And it's often pointed out that that common grace plays at least a restraining role within the world. I suggest the notion, that is for the, as a common grace concept, the notion of human finitude. Dan has both opened the door for human finitude, playing a role, but I think also shut it rather quickly, and then let it open a crack. Dan raises the question of whether death and human finitude is a metaphysical truth or an empirical observation. He would seem to close the door on finitude playing a common good role when he says, if human finitude is a metaphysical truth, then the quest for immortality through science becomes the basis of a deep and desperate delusion. The implication of this, at least seemed to me, is that finitude and hope are closely linked, and that without a particularistic metaphysical, that is, Christian conception of finitude, we have no true conception of hope. And Dan, interestingly, seems to let the door open a crack for a natural understanding of finitude that might at least play some role in the common good. He points to two dead-end conclusions that are logically reached if we operate from a mechanistic paradigm that accentuates infinite human capacity, especially in medicine at the end of life. And I think the one dead-end conclusion he actually skipped over in his paper, but one dead-end street that he points out is that a mechanistic and non-finite view of death actually eliminates life. Quote, empirically, life is defined over against death. Paradoxically, then, success in the mechanistic struggle to eliminate death would imply the elimination of mechanistic life. So you see the logical contradiction there. I think there's a fascinating point there. A second dead-end street he did mention, that is that a mechanistic approach implies that all of life's relevant phenomena can be mathematized, summed in proper Newtonian equations. From such a mathematical perspective, however, one quickly realizes no finite function can generate infinity. From these logical fallacies, Dan moves back to hope and notes that if the deepest desires of human beings are for infinite life and infinite love, then these desires cannot be humanly fulfilled. The finite can never add up to the infinite. The finite has been informed by the infinite, and this is our only source of hope. And I totally agree theologically. Hope will not be achieved by natural or mechanistic means. All such versions of hope will be disappointing, and we might even argue self-defeating. But it seems to me that the notion of finitude, while having a particularistic theological understanding as Christians, can be perceived by reason, by human experience, by the illogical outcomes of eliminating finitude, as Dan so well pointed out, and by the limitations of medicine that are empirically evident every day. Acceptance of that human finitude can in part be understood broadly without the particulars of the biblical story or without the Christian understanding of hope. But I would add, it will only, of course, be understood in part. For the original human sin was an unwillingness to accept finitude, with the desire to be infinite, knowing and doing all things within oneself. And yet, it's also been noted that sin is the one empirically verifiable Christian doctrine. Why? Because we see its effects everywhere and throughout all humanity. Similarly, it seems to me that we empirically see the realities of human finitude just by even looking within ourselves. Accepting some even natural notion of finitude and attempting to impact the common good through an appeal to finitude could at least play some role in mitigating the excesses in death and dying, i.e. Susan Sontag, and in challenging the defects that our only hope is a way out, as in euthanasia. Hope will never be brought to the world by medicine or through the structures and paradigms of medicine. Hope is only found in the good news that the infinite one became finite, that through him we might know that infinite one, and hence accept our role as finite creatures living in and for the infinite one in this finite and fallen world. But as those who are grounded in hope and live according to hope, perhaps our natural appeal to finitude, demonstrated empirically, rationally, existentially, might make some dent on a world facing the realities of sickness, death, and the allocation of scarce medical resources therein. Such an approach, of course, is a reflection that until the eschaton, we live in two worlds. One informed and guided by transcendence. The other informed and guided by natural assumptions and finite realities. Our hope is in the one world, and it is our ultimate home. But our calling now is to live in this other world for a little longer still.